Welcome back to Medical Mondays. I'm here with Dr. Melissa Walko from Women's Medical Associates of Nashville. So if you have a question, go ahead and give us a call. We'll also show you how you can make an appointment with Dr. Walko here in just a little bit. So you might want to grab a pen and paper and we'll get you set up for that. We have a number or an email address that you can send a message to. So we're going to get you hooked up. In the meantime, I'm going to continue to ask the questions unless somebody calls in. 615-737-PLUS is the number to call. Let's go over the care schedule that someone can anticipate for that 9 months, really 10 months of pregnancy.
Sure. So usually when I see patients, they're around that 8 to 9 week mark. Okay, so that's the first trimester. And you know, in that stage, we usually see them every 4 weeks. Okay, obviously if they have a complication or something that we need to see them sooner. And then after that, you know, initial 4 weeks, we'll do every 4 weeks up until the second trimester. Then we start doing every 3 weeks. As you get further into the third trimester, every 2 weeks. Okay, and then at 36 weeks, it's every week after that, okay, until the end. And usually I tell patients every time I see them after that, could be seeing you on labor and delivery, but if I don't, I'll see you next week in the office.
And what do you do in that final stretch when you're in, you know, on the weekly appointments? What are you checking? So
every week, you know, we'll do a vaginal exam, check the cervical dilation. I'll go over with patients, are you having any contractions, any leakage of fluid? I'll give them all the precautions that we give for our term patients. So making sure that they're doing their fetal kit counts, you know, making sure that they're paying attention to the baby's movements, giving them precautions as far as bleeding, leakage of fluid, what to prepare when they go to the hospital. You want to make sure that you let your OB know when you're going to the hospital. That's important. And, you know, just any general questions, because patients, I find as they get further toward the due date, they start to have more and more questions rather than less questions.
I'm sure, absolutely. What about, and this is a question that maybe some people won't ask you because they're embarrassed, sex with pregnancy. It's okay, right?
Yes, I get that question actually a lot, usually from the partners. And
that doesn't surprise me.
And I tell patients, unless your OB has specifically told you, there are a couple of conditions where sex is unfortunately a taboo for the entire pregnancy, but obviously your OB would go over that with you. So unless you have one of those conditions, sex is totally fine. Now, if you want to tell your partner something else, that's
on your own deal.
Up to you.
We talked a little bit about diet at the beginning of the show, and I do want to talk about it again because, you know, we also talked about common myths, and people are like, oh, she's eating for two. That's not really the case, right?
I talk about that with patients from the very first visit, and it's a sensitive subject with women. And I tell patients, you know, this isn't to criticize, hurt your feelings. This is telling you because it's best for you and your baby. So if you are at a normal BMI when you become pregnant, so that's a BMI that's less than 25, and that's easily calculated. I'm sure there's many Google calculators for calculating your BMI. Obviously your doctor would also calculate that for you. If you're at a normal BMI, 25 to 35 pounds, totally fine. Okay. If you are overweight, there's different levels, you know, varying levels of being overweight. So overweight, obese, your doctor will talk to you about that. But if you're overweight, usually no more than 25 pounds is recommended.
And keep in mind, I guess, when you're having your meals or whatever, you're not eating for an entire human being, but you do need good food for that growing baby.
Certainly, you know, a lot of women, they kind of see it as their opportunity to kind of eat whatever they want, you know, just give in to those cravings, and those cravings are real. You know, I've been pregnant myself, I understand. But, you know, I tell women 300 extra calories a day is really what you need to...
For the span of the pregnancy?
For the span of the pregnancy, to give your baby, you know, the nutrients that it needs. And babies get nutrients no matter what you get. You know, those babies, they get what they need in general. But 300 extra calories, so that's really
not a lot.
That's not a lot. That's maybe a half a sandwich and a piece of fruit a day.
Yeah, but it is okay every now and then to splurge. I mean, why not, right?
You know,
as long as it's every now and then.
Of course, and that's what I tell patients. I say that's kind of the fun of being pregnant. You know, eating the ice cream. You know, that you normally wouldn't eat, eating the donut, eating those, you know, cravings that you have.
Sure.
That's part of the fun of it. You just have to do it in moderation. You know, gaining too much weight, again, this is another thing I tell patients. This isn't to be critical, it's not a vanity thing, it's for the health of you and your baby. So gaining too much weight during pregnancy puts you at an increased risk for a variety of complications. It puts you at an increased risk for gestational diabetes. It puts you at an increased risk for hypertensive disorders of pregnancy, so disorders where you have problems with your blood pressure. And that can lead to a variety of problems with the baby itself as well. So, you know, not to be critical, but
sure, but to be informed.
In your best interest, yeah.
Yeah, absolutely. Absolutely. It is very important. Oh, my producer was cutting, and I thought she was going to tell me, and she did. Samantha's on the line. Samantha, thank you for calling in tonight. What's your question?
Hey, I just had a comment.
Okay.
About nutrition in pregnancy. I just wanted to say, before I got pregnant, I never would have ever touched kale, and after I got pregnant, I craved it, so I went with it and got some and ate it, and now I can't get enough of it, and my baby is almost a year old, and she loves kale too.
Isn't that funny?
To encourage all those crazy cravings. Sometimes they might be good for you.
Oh, absolutely. You're absolutely. In my first pregnancy, Samantha, thank you for calling in. I craved grapes like nobody's business. I ate so many grapes, and my son loves grapes. It's crazy. I don't know if there's a correlation.
No, there definitely is a correlation.
Is there?
So that's another thing that I tell patients, you know, give into those cravings, but remember, this is your one opportunity to grow this baby. This is your one opportunity that this baby is developing. So pay attention to those nutrients. Try to eat a balanced diet, because in addition, the same thing, the baby likes kale. Well, those babies, you know, there is some research that shows that if you eat certain foods during pregnancy, that the babies will have an inclination toward them later in life. And certainly, you know, kale is a wonderful craving to have. So.
No joke. But my second one, I wanted sweet, so I got off the grape kick.
Yeah, I liked donuts. So.
You know, pregnancy should be full of joy and bliss. Sometimes getting pregnant or staying pregnant is really just a heartbreaking situation. Let's talk about miscarriages a little bit. You know, what do you see? What causes them? What do you tell patients when it comes to trying to get pregnant again? Sure.
So, you know, miscarriages are very, very common. So, and that's one of the first things that I tell patients, because they're devastated and they want to know, why did this happen? You know, what was wrong? How could I have stopped it? In general, I tell patients miscarriages are very common. About 20% of pregnancies end in miscarriage, and usually that is due to a genetic defect in the baby. So the baby had a trisomy, an extra chromosome, where the baby would not have survived. Okay, if you had carried the baby to term, baby wouldn't have lived much longer, or the baby might have died later in the pregnancy, you know, in your second or third trimester. So usually a miscarriage is for that reason. Now, if I have a patient that has had multiple miscarriages in a row, then that indicates a further workup. So I would usually recommend those patients to a maternal fetal medicine specialist who specializes in somebody with high-risk pregnancies or with recurrent pregnancy loss.
And what are they looking for or looking at that point?
So usually they'll look for if the mother and the father of the baby are carrying some of those genes. So if they're both carrying some of those genes that can put them at a predisposition for having a baby that you know, that causes those recurrent miscarriages. The mother can have a variety of different genes that she carries that really have no effect on her whatsoever, but certainly could affect pregnancy.
And once somebody has had a miscarriage, how long should they wait before trying again?
I usually tell the patients, I mean, it depends, because again, we have patients who are older population, and older, I mean older than 35. Okay, so it's not old. That's not old by any means, but reproductively speaking, for a woman, we call that advanced maternal age. So, but I usually tell patients to wait a few cycles. So wait, you know, at least 2 or 3 periods before they try to conceive again.
And is it just to kind of get your body back in its normal working order?
Your body, your mind, your mental well-being, everything. Exactly.
Makes sense. And then fertility-wise, you were saying earlier, try for at least 6 months more like 12 before you kind of really set off the alarm bells.
Right. Again, like I said, most patients, they're in our office long before that 12 months.
Yeah.
Okay, so usually around 6 months is when we're seeing those patients, because they get antsy
Sure.
and they get nervous, and that's perfectly fine too. I mean, I'm happy to see my patients, you know, even if they've been trying for a few months, I'm happy to see them and go over, you know, kind of what they're doing, you know,
Sure.
when they're having their intercourse, you know, when they're timing it, etc., and go over any questions.
Fantastic. Speaking of questions, if you have a question, would like to make an appointment with Dr. Walko, get your pen and paper ready. We are going to give that to you right when we come back. So do that in the break, and we'll see you right after this.